We're going to talk about a lot of things, and I'm not going to talk about each of these things in particular or especially, but each of these areas help us get to know your child a little bit better, and also help to see compare the child's functioning to those symptoms related to autism. So we'll see communication and social skills, patterns of repetitive or stereotyped behaviors. All of these things of general behavior and functioning are the meat of what that evaluation is going to look like. And that's all conversation with you as the parent. There, we want to make you aware there are things that we know affect child's development and behavior that are important for us as a psychologist um, to know and to consider as we think about a diagnosis. So there are some questions that might seem a little sensitive or might seem like you're not usually having to talk about that we might have to ask. Things like guardianship, things like what are the living arrangements? How do we relate to different parenting practices? We'll talk about family history because we know there's a genetic component and likelihood of autism. We want to know what's that history like on the family. We'll also need to talk about traumatic experiences, um, abuse, periods of neglect, things that have been really hard in the child's life, are important for us to consider. And again, just to get to know that child the best. I do need to say in this area, we do write a report. So the outcome of this evaluation will be a written document, and the things that are relevant to the child's functioning will be included in that report. That is not to put anybody on blast or to cause any blame. But again, we are trying to know and support that child the best way we can. And so it's important for us to know that if this is big in our child's life, that it's something that we consider.